Hi, this video is the art of hair transplant restoration surgery on a client with a class 3-4 hair loss pattern. And so basically he's thinning most in the front, although he has some thinning in the mid-crown area, but it's still quite a bit of hair. I'll go to harvest around 3,000 grafts, and 3,000 grafts will cover the front half. Sometimes 2,500 can, but the fact that we're working on both temple is automatic. It has to be around 3,000 grafts. Because each temple eats up around 200 grafts to 2,500, so we bring up to 500 grafts. The most important thing is the frontal area, and hair transplants, as you know, it's not just the surgical skill of the surgeon, it's the whole artistry behind it to ensure the result is very natural. And we gotta focus heavily on the artistry of hairline. And once the result is in, it will be as if when you walk down the street, no one knows that you have had any surgery done, because it will look natural and nothing artificial. And the other important factor is as if Dr. Diep never been there, and that's really important. When I built the hairline, I built it according to each individual facial structure, as long as overall proportional. From the mid eyebrow to the hairline is a third, from the mid glabella to the tip of the nose a third, from the tip of the nose to the bottom of the chin is a third. So probably somewhere around that proportion. If it off a little bit, half a centimeter, 1 centimeter, it doesn't make much of a difference. And then the more narrow the face, the more arched back the hairline is. The more round the face, the more flat the hairline is. And when we lower the hairline, if the temples recede backward, we had to bring them in as well, because if we don't focus on the temple, you just have a low hairline and a wide forehead. Yeah, you have some hair, but it's a slight off. And again, I'm a perfectionist, and I want to make sure that every meticulous detail pay attention to every meticulous detail, really, to make sure and show the result is very natural. So if you look on this side, and you see he's thinning here. He has some hair here. So the great part is he's getting thin. So what we need to do, we just follow the natural pattern of it. And this one, so we don't change the angle nor where the position is, because the rule of thumb is where the eyebrows end, you put a finger breadth, you go straight up. That's where the temple should begin for men. For women, it's different. So that's why here's this, just increase the density. And it's the same thing as this side. This side we see a little bit further back, so I had to bring it in a little bit. And again, where the eyebrows end, we'll put a finger breadth. We go straight up, and that's where his temple is. And we just connect them and follow and increase the density. Now, once we get the shape down, we will transplant at a very precise angle of 35-45 and change this one to a different direction. The important factor is the temple. It had to be flat against the skin and pointed backward. Some of the temple, unfortunately, I've seen where people have made a mistake and had the angle straight perpendicular out. That's wrong, so it had to be flat and pointed backward. And the type of hair of the temple, we like to use a lot of root that grows single hair, because you want a soft and natural. You don't want no harsh root, because the idea of the temple is not for density, it's for framing of the face. And you notice most of the hair on the temple are baby hair anyway. So that leads us to selection of hair graft, because not just the precise angle is important. We transplant rows and rows single hair graft in the front to ensure a very soft and natural, followed by root with 2 hair, 3 hair, and 4 hair in the back for bulk and volume. And so you can see his temple is a little bit further back, so we brought him in. Yeah, I'm very excited for him, because I know in a year later, with a full set of hair, he will look different. And we will do a year follow-up video, and just continue to pay attention. So this is the art of hair transplant restoration surgery on a client with a class 3-4 hair loss pattern, and we are harvesting 3,000 grafts to focus on the front and the temple. Thank you.